If a patient has a mutation on the BRCA gene, either germline or somatic, she will have a much greater chance of responding not only to a PARP inhibitor, but also to a platinum-based regimen. When PARP inhibitors first became available, I could use them only in the BRCA mutated setting. So what I would do if they were BRCA negative is I would send the tissue to Myriad Genetics, and they would do the HRD testing. If the patient is BRCA negative but HRD positive, in my opinion, she has about as much of a chance of responding to a PARP inhibitor as though she had a mutation on the BRCA gene. It absolutely would be my choice in the second line setting, which is the first recurrence. I said I would give Doxil and carboplatin, and at that time I would give a PARP inhibitor as maintenance. Now the NOVA trial is very, very interesting, and my practice accessed the largest number of patients access to the NOVA trial, and I was one of the authors in the New England Journal of Medicine paper. And briefly, all of the patients were adults. They had epithelial cancers of the ovary, fallopian tube, or peritoneum. All the same process. They were in partial or complete remission to a platinum-based regimen. And they were randomized 2-to-1 to receive either niraparib or a placebo. And there were 553 patients in this trial. 203 had a mutation on the BRCA gene, and 350 were BRCA wild type, which means they did not have a mutation on the BRCA gene. It was a very, very excellent trial. In those patients who were BRCA wild type, they were broken down into whether they were HRD positive, homologous recombination deficient positive, or also whether they were somatic. If they were BRCA wild type, were they positive? Did they have a BRCA mutation in the cancer cell itself, which would make them somatic BRCA mutated? Well, basically, with the twist analysis, that had to do with the quality of life, actually, and it had to do with the time of the adverse events subtracted from the progression-free interval. When you were given the niraparib, they had a much longer time without symptoms or toxicity. Twist means time without symptoms or toxicity. If you're going to deal with these patients and take care of them properly, you like to be able to choose the best treatment for them, but also try to mollify somewhat the side effects if that is possible. Well, the end point, they were treated until toxicity or until recurrence, unacceptable toxicity or recurrence.